structured benevolent touch already. By hugging, by giving a handshake, by putting your arm around someone, by just resting your hand on someone's shoulder, by patting someone on the back, or just with sitting with them and listening to some nice soothing music. These type of touches are spontaneous, and it's a positive contact that suits the immediate situation. Okay, they are the most natural form of human expression. The second type of benevolent touch is a structured benevolent touch, which consists of steps for you to do a massage or relaxation techniques. So the structured benevolent touch would include a hand and facial massage, breathing exercises, slow stroking, back massage, and foot massage. You should always allow plenty of time to do a structured benevolent touch massage, because it can be very relaxing to sore muscles. And actually, a back massage can help with the total well-being of the client's body. When these techniques are completed properly, a good massage can be invigorating, and it can be one of the greatest delights of life. The third type of benevolent touch is traditional benevolent touch. This includes gestures and tasks where you have to touch someone in order to complete the task. Some of the main examples would be activities of daily living, when you help to feed someone or to bathe someone, when you're helping someone get dressed or you're helping to toilet someone. You need to touch them in order to do those activities. So if you can use a caring and gentle, benevolent attitude when doing that, it will make the process so much easier for that client. Also, some other traditional benevolent touch would be petting of animals, dancing, and taking people's blood pressure. Those are all traditional benevolent touch. So just to review, there were the unstructured benevolent touch, which would include handshaking, holding hands, arm around your shoulder. There's the structured benevolent touch, which would include the steps to doing a back massage or a hand massage or a facial massage. And finally, the traditional benevolent touch would include the activities of daily living, as well as other tasks where you need to touch someone in order to complete the task. The guidelines for benevolent touch are very simple, yet very important. Number one, know your client. You want to make sure that you ask how they're feeling when getting their massage or their benevolent touch. And if they can't verbally tell you, you want to be able to watch their body language and their non-verbal cues. The body will tell you to either move on, continue doing the massage, or back off and get to know that person a little better. Number two, you need to ask permission. Before touching anyone, you need to look them in the face, get some good eye contact, and ask, would it be all right if I give you a hand massage? Or, how would you like a hug this morning? And then use your good judgment to respond to those answers. And the third guideline with benevolent touch would be, you, the caregiver, need to be centered. The art of centering is quieting yourself, both physically and mentally. You need to let go of any exterior distractions and things going on in your life, because you need to focus on helping your client. We all need to have time for self-nurturance. And by listening to this song, you can't help but feel good about yourself.
How could anyone ever
Before using benevolent touch, there are a few things you need to make sure that you consider. For example, a comfortable environment. You want to make sure that the lights are dimly lit and there's not a lot of glare. You want to make sure that the room is warm, that it's a pretty quiet location, and that there's some nice relaxing music that you can play. Also, you want to make sure that your hands are clean, obviously, when given benevolent touch or doing some kind of massage. Also be aware of any sharp rings or bracelets or watches. And also making sure that your nails are trimmed. You would not want to scratch your clients. By learning these basics of personal touch, you will gain an attitude of benevolence. And you will become a more compassionate person because you're knowledgeable about the importance of touch and its healing properties. You will have the power of touch. So in conclusion, I'd like to end this lesson with a demonstration of 2 of the several structured benevolent touch techniques. And please feel free to practice these techniques along with the demonstration. Good luck as you continue to be a caring, nurturing healthcare professional. Position the person on a chair, preferably without a backrest, leaning forward against a pillow on a tabletop, or lying on their side in bed. Using one hand, stroke the back, beginning at the base of the neck and progressing down to the sacrum or tailbone. Do not remove the hand until the opposite hand is at the neck to repeat the stroke. Alternate hands firmly, yet gently, down the back, continuing for 1 to 3 minutes. We've just completed 1 minute of slow stroking. Position hands comfortably on a table or an armrest. Apply hand lotion if